What is the difference between dentures and implants? It's actually quite a wide difference. Both of them, you've lost a tooth. The reality is that once you've lost a tooth, you can never truly replace a tooth. You can give a replacement for no tooth. And that makes it rather complicated, because in most of the cases when you lose a tooth, you lose the bone and the supporting tissue and everything around it as well. Dentures was the first way that people came up with a way to replace a tooth. It was a piece of plastic that was set in the top of the palate, and it sucked onto the tissues, and that was a way of trying to replace a tooth. It's not something that we do in this practice commonly. Most of the cases we prefer to implant a patient and give him something permanent. Now, a denture would only replace the chewing surface of the tooth, and all the force is carried by your gum or the surrounding bone. In an implant, we actually replace the root of the tooth, and we give you the opportunity to have a fully functional tooth again. The big difference in modern dentistry as far as implants versus dentures are concerned are the patients that have lost all their teeth. In those patients, as they age, and it takes about 20 or 25 years before they actually lose enough tissue support to have a loose denture, and that denture starts floating around in the mouth. Every dentist that patient has for the rest of his life is worse than the previous one, because there wasn't enough tissue to really repair the denture or to give them a denture that's going to sit properly. So what we do nowadays is we place 4 or 6 pins in the jaw, and we actually screw that denture onto the bone, and the patient's got something that is fixed again. They can laugh, they can function, they can feel. It's a replacement of no tooth, but it replaces 95% of your function and your aesthetics. So in my practice, most of the cases we implant, and we prefer not to do dentures.
Your dentist, your choice.